This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
This is Sarah, and I just want to take a moment to speak to you about this week's sponsor, Favor. Favor, Inc. is a statewide family-led nonprofit 501c3 organization that is committed to empowering families as advocates and partners in improving educational and health outcomes for our children. Favor is the Connecticut state organization of the Federation of Families for Children's Mental Health. Favor offers a single place for families with children who have medical, mental, emotional, and behavioral health challenges to find information, assistance, and training. To find out more about Favor, please go to favor-ct.org. We are grateful for our opportunity to work with Favor as a sponsor, and now on to the rest of the episode. Hello, everyone, and welcome to Caregiver Chronicles. My name is Sarah, and today I am here with Lisa Girard and Shannon Ozkan from Favor, Inc. Hi, guys. How are you today?
Great, thank you.
Great, thank you for having us.
Good. Oh, I'm so excited to have you guys here. Favor is I actually work with Favor, just to let my audience know that this is where my support group's from. That's how I got to know Lisa. So I'm so excited to have you guys here. I really am, because your organization has done a lot for my family. And I just want to really quick describe your organization to my audience, and then I'll have you guys introduce yourself. Favor Inc. supports, educates, and advocates for families with children who have special mental, emotional, and behavioral health challenges and or developmental or intellectual disabilities. Lisa, would you like to further introduce yourself?
Sure. My name is Lisa Girard. I work for Favor Inc., as Sarah stated, and I am our family systems manager for the eastern region of Connecticut and cover 58 towns.
Thank you so much. And Shannon?
My name is Shannon Ozkan. I'm a family peer support specialist. I cover the New London County area, and I go into the families' homes after a referral is made to help them find the support that they need within the community.
Awesome. That's great. And thank you guys so much. Do you guys want to talk more about Favor and its mission?
Sure. So Favor was created as a response to the need for leadership and coordination among family advocacy and support groups in Connecticut. We were founded in 2001. Our mission is to provide family-focused, advocacy-based, and culturally sensitive community services that improve the outcomes for families and youth well-being. And we empower families to advocate for themselves at all systems levels using the Wraparound approach that recognizes the importance of family and youth voice and lived experience.
Thank you. Shannon, would you like to elaborate on that, or?
No, I think Lisa nailed everything that we basically do. We offer support all the way around. The WRAP process is a good process for families to go through, and it helps them discover different ways of advocacy, how to utilize supports, and where to find them.
So can you explain to me what the WRAP process is?
So Wraparound process is in Connecticut, where essentially we're wrapping families in care. So we're connecting families across whatever sector. So it could be community-based, faith-based, it could be school, rec departments, whoever is in their community for supports, and kind of wrapping the family in care. I forgot care coordination is one that we connect families to. So basically wrapping them in support, and that's what we call the wraparound process. Shannon, do you have anything you want to add to that I might have forgotten?
The only thing I would add is that we all come to the table as a team, and we work on assisting the family in their way that they need assistance. So if we did refer to care coordination, or if there were behavioral health providers or school providers or community supports, we would all come together and have a meeting to see where we could further help families meet their needs.
It's all family led. So whatever their need is, not what perhaps a provider, we've all been in those situations where a provider has said, well, your family needs this. And that's not what it's really the wraparound's about. It's more what the family is saying that they need. And we help as Favor to advocate with the family for that. So even necessarily if we're like, well, in our personal opinion might not be the best option, but that's what the family is wanting, that's what we're going to advocate for them with other providers while we're connecting, making sure that everybody's communicating for what the family sees as their best, what their goals are and what their outcomes are.
Awesome. Thank you so much for explaining that to me, because I was unaware of that. I really like that it's family-based, in that it's, the wraparound around the community, in that it's family-led, because sometimes programs, especially, and I just want to say this as a mom, there were times in the beginning of the journey of my child's diagnosis where I felt like I had to do what everyone else was doing with my kiddos. Yes. And what everyone else was doing, saying, feeling, or needing weren't necessarily fitting the needs of myself, my family, especially having a unique work schedule with my husband at the time, and just having two unique kiddos. I really appreciate and admire that when you're looking at the families and what they need, because every family dynamic is so different.
Absolutely. Yes.
And I would add, as well as with the families, we're also asking our youth what they need to be successful in the community. I'm a very firm believer in nothing about them without them when it comes to families, and it includes our youth who are experiencing it, because even if when we're doing the wraparound process and we're talking with family of what they need, what their goals are, oftentimes the child is forgotten in that process, and they could come up with an idea. They know what they need. They know what they're experiencing, and they might have out of an idea that we have not even thought of that's going to work. So to include their voice and that they have a say is something that I firmly believe in. So I think just to include, yes, the families, but also the youth, and making sure that they have what they need and have a say in a space to be able to say it. So that involves kind of the wraparound process as well.
Awesome. And again, I love that, because, I have one child who can advocate for himself in a lot of ways. He can say, I wish there was more blank in town, or I wish there was more blank at school, whatever service it is, insert service here. And, there's times where he can say that he needs more of something. And my other child, unfortunately, does not have that capability. That being said, I have to be the advocate for them, but to include the whole family in that process. And, you can also, there are family dynamics where you can ask the mom, hey, what do you think the family needs? The mom will say one thing, and then the dad will turn around and say, we need that, but we need this too, because not all the time does family realize every area they're lacking in. Everybody has different perspectives. So I really, and especially including the children and the youth in the program, because, you guys wouldn't be coming and supporting families if they didn't have, whether it be young children or adult children with some type of behavioral, mental, or physical problem. So I think that that's fantastic. That's one thing that I really like about your organization. So do you want to talk a little bit about, I know you mentioned when, but do you want to talk more about how Favor got started?
So like I said, we got started back in 2001 is when we officially became incorporated. And we were started as a statewide family-led organization that's committed to empowering youth and families as advocates and partners to improve the educational and health outcomes for themselves and their children. And we offer a single place for families and children who have medical, mental, emotional, and behavioral health challenges. And we offer support through a variety of different programs, but also information and training. And I think that's one of the most important things that Favor does offer across all of it, is that support and empowering families through training and just guidance. Sometimes people just need a place to say, okay, I don't know what the next step is. So Shannon, anything you want to add to that?
I would just add that sometimes parents feel like they don't like that they're told no, and no is the final answer for certain things. So teaching them how to appropriately advocate for themselves and their family and their child is the main goal of Favor, for my program, to teach families how to, for the peer support, advocate at all levels. And sometimes hearing no is very hard, and you accept that no for the moment. But then when you have peer support behind you saying you don't have to say that that's okay, you can go back and say, your no was not okay with me. Let's talk this through, and advocate in those aspects.
Absolutely.
Thank you both for that. I just want to say, like, I appreciate you saying sometimes families don't know where to start. I remember when I first walked into the support group led by you, Lisa, I saw tissue. All right, so little Caregiver Chronicles backtrack story here, if nobody minds. I was in the beginnings of my autism mom journey, and I was having a hard time with both of my kids' diagnosis and just sleep regressions and everything like that. And I remember it was suggested by the doctor that I join a support group. And I hate crying. I don't like to cry, and I don't like to see people cry. It stresses me out. I feel awkward. Even with all my experience in healthcare, I feel like I have to do something to fix it or make people stop crying. And I knew that if I walked into a room full of people crying about similar circumstances as me, I'm not going to be able to help them because I don't know what to do. And I was just terrified. And I remember walking in that room so scared and seeing boxes of tissues everywhere and being like, oh no, here we go. Like this, there's going to be a tear fest. And taking some deep breaths. But there wasn't really a lot of tears. It was more, I think we laughed more than we cried, because we all found the humor in our situations versus, the fear. So I just want to share that and say that, the support groups in those types of services, the family services, are great. So getting into that, can you list off some of the programs that are offered?
Shannon, you want to start?
Yes, some of the programs that are offered is family peer support specialist, which is myself. We generally will get a referral, which can be found at favor-ct.org. And it's at the bottom of the page. Once you click on peer support, it'll bring you to what a peer support role is. And then you scroll to the bottom and there's a referral process. Referral processes come in two ways. We either get them from a family or a family friend, and it's called a brief. And usually during a brief, we're open for 3 months. And another way that a family can be open with us is through care coordination, which as long as care coordination is open, we can stay open with the family to help with the peer support part, which is going out to the family's home, getting their vision of what their family would look like with all the components they need to make their family run smoothly put in place. A lot of times it's school struggles. They struggle a lot with the school districts and getting the appropriate accommodations for their child. So we would go to a PPT meeting and address those issues and get the proper accommodations for that specific family. Right now, we're kind of seeing a lot of referrals coming in because kiddos have lost all of those skills that they had built pre-COVID. All of the tools they were using and all of the structure that was being maintained while in the school setting, a lot of those things kind of dwindled away because they were at home and it was virtual. So now they're just needing an IEP to put back in place what was there before so they can relearn these tools and these concepts and the supports that they had previous to COVID so that they can get their toolbox full again of all their coping skills. So that's been we've had quite an uptick in some of those referrals. Another part of our program that we offer is medical homes, and families can get the support they need for respite or costs of medications or devices that their insurance won't cover. Generally, you have to be in the bracket of 400% below poverty level in order for you to be eligible for some of those components. There is one part of medical home that is for that specific purpose. And then we have medical home that is for respite care services, which is for you to get some reprieve from some of the stressors that can go on daily with just having kiddos in general. So there's that program as well.
Thank you for all of that. I think I would just add for medical homes, specifically, I'm not sure if it's other places, but the Katie Beckett waiver program is a program that allows the state of Connecticut's Department of Social Services to provide Medicaid services to individuals 21 and younger who have a physical disability and may or may not have a co-occurring disability, who would normally not qualify for Medicaid due to family income. So there is our medical homes director is able to kind of help guide some of that and answer those questions regarding kind of the ins and outs and how, and the applications for all of that. And more information can be found on our website about medical homes. So for another of our programs is the Family Systems Manager Program, which is one that I am part of. There are 6 of us across the state of Connecticut in different regions. I, again, cover the Eastern region. So Family Systems Managers, our programming is unique in that we collaborate with families, but we also collaborate with service providers. So to increase community and program effectiveness. So we're looking at policies, procedures kind of that are in place, making sure that they're family friendly, that families can understand what is being said. I know personally, I've been at meetings where before I became an FSM, where I was like, wait a second, did they get any family voice before they made that policy and procedure? So really kind of going back to nothing about them without them. We also help to foster family involvement, again, in decision-making about the policies and practices that affect the well-being of their children. One of our main goals is to ensure that families, caregivers, and youth become active and equal partners in Connecticut's network of care. So that's, again, one of our goals. We have a bunch of different objectives. So I'm going to give you just a few of them, but to educate, develop, and support families and youth, educate, develop, and support our system partners. So kind of working at different levels between, and sometimes being that liaison between, if a family can't come to a meeting, they're experiencing certain concerns, the FSM would be that liaison at that meeting. Sometimes the providers have questions for us to bring back to the family. So that's another role that we kind of take on as well. And we also support the development of integrated family-driven system. So to elevate and strengthen the family voice, again, to support youth and parent leaders. And that's really our ultimate goal, is to help develop and shape youth and family leaders, essentially work ourselves out of a job so that the network of care in Connecticut becomes child-centered and family-driven. Another way that we can work with providers and agencies is that we can offer technical assistance in the way of mentoring them to assist in the development of family-driven and youth-guided practices in their systems and then in their advocacies and in their policies to make sure that families and youth are included. It's important to remember that youth and family engagement's not like a single policy or practice. It's a mindset about collaborating with families in ways that respect their knowledge about their children and their communities, and using their lived experiences to shape policies and procedures. The other program, last but not least, is Favor has a Learning and Leadership Academy. And prior to COVID, we were doing this in person. Now it is all virtual, which we have found has been working really well for families. We've had families and providers from outside of Connecticut join us on Zooms just to kind of learn some of the trainings that we have. And it's awesome to see when we had someone just a few nights ago from Iowa join us on a Zoom call and spoke very highly of how it was convenient and it was educating to be able to utilize that Zoom platform. So all of the workshops that I'm talking about are on Zoom. So there is that option. There are a lot of workshops that we do, but really our goal is to help educate families, but really to empower them to be able to use their life and their experiences and their expertise of their own lives and their children's lives to be able to advocate. So we have a couple of categories. We have our advocacy trainings. We have one that I recommend highly, how to be your child's best advocate. And that one really talks about the school setting, how to read an IEP, how to advocate, as Shannon mentioned earlier, and when you're being told no and you're in that moment of emotion. And it's a very good training. Lots of folks get lots of information from that. Shannon, do you want to say anything more about how to be your child's best advocate?
Honestly, that's one of the ones that I love the most. Years ago, I was told by Care Coordination they were having a session in person at UCFS in Norwich. And I went and I fell in love with the training. I was like, oh my gosh, this is so great. I wish I would have had this before. Like, this is like the key to advocacy right there. Like, it was a shining moment for me. So for me to now work with the individuals that gave me that piece of me that I was missing, the power to advocate, they are now people I work with. So it's amazing how I can go from being in a Favor training to now working at Favor is amazing. And I just fell in love with the advocacy portion of it. In my free time, I was actually helping families. Because of this training, I was taking that material and helping families advocate for their children. So it's just been a nice ride for me to see how that training helped me to where I'm at now with helping so many more families. I recommend all of our trainings to our families because really the trainings are what gives you the information, the PowerPoints, the presentations, the hard copies of information that you can go back later and read because you may have missed something. So those trainings are really important to the families that we serve because they help them through all different aspects of advocacy and learning.
Absolutely. A few more that we do for advocacy trainings are Network of Care, Agents of Change. So that really kind of talks about what our network of care is, like the what. What is it? You hear network of care and you think, well, what is a network of care? So we go over that. And then Agents of Change is really just a fancy way of saying how to find your power. We're going to help you find your power and navigating that network. We also have Persuasive Storytelling, which is a very good training. It talks with families. It's a little bit longer of a training because the trainer, the facilitators work a little more closely with the participants towards the end to talk about their story, but it really talks about how to advocate and use your personal experience, use data and your personal story to effectively advocate in whatever setting you want to advocate on. There is also a What's Your Story youth segment, it's a shorter training and it's specific towards youth. And it's also like persuasive storytelling, but geared more towards youth. What is their experience, how they can use information to advocate for themselves. We also have a support group facilitation and financial management training. So that really talks about how to facilitate a support group, all the things that go into it, and then the financial management piece, because in Connecticut, there is some grant funding that we can request to kind of support the support group as a whole. And then the FSM kind of supports through that. Family Systems Manager, I don't mean to speak in acronyms, can support with that financial management piece afterwards too as a support. We also offer, these are some of my favorite, data focused trainings. So there's a 101, like part one, it kind of talks about what data actually is. Data 201 is more, how do we use data? Where can you find it? And then Data 201 is really like, how do you use data to advocate effectively while using your story at the same time? And then we have an upcoming series that will be called Understanding Our Unconscious Biases. So that'll be an up and coming training. All of those trainings are available in English and Spanish. We just ask folks when they register if they need translation to check that off on the registration. How to Be Your Child's Best Advocate is offered in Spanish as well without a translator. Our other programs, again, English, are offered in both. And if you are interested in any of those trainings, they sound good to you, the person to contact for that would be Jaquise Patterson at jpatterson@favor-ct.org. And she would be the person, she's our program coordinator for the Learning and Leadership Academy, and she'd be able to set that up for you. So it can be for other parent groups, support groups. It can be for your agency. So it could be pretty much anything that you envision it to be.
Awesome. Thank you so much for that. That's all really great information. I am going to make sure that I have that email and Mrs. Patterson's information in the show notes for my audience for anybody who needs more information. So it sounds like you guys work with a lot of other agencies. Would you like to talk about some of the other agencies that you work with?
I work very closely with care coordination. When a referral comes in, I will work with the care coordinator and the family to meet their family vision. When they first open with care coordination, the care coordinator will go into the home with the family and ask them what their vision is. What do they want to see? If their life could look better in 6 months, what would better look like is the key to getting families to where they need to be. So working closely with the care coordinator is a very big part of the puzzle, and with the family. So that's where that wrap process comes in that we were talking about, the wraparound. It's when we all come to the table and we see that family's vision and we ask them, what steps do we need to take to help you get to there? What is the stress of the family? What is the dynamic that might be needing to be broken down smaller to find what could be the key component to getting the family to that vision? Also, we work a lot with the schools. Even though the family may have some issues with the school, we always want to maintain that relationship, because under every circumstance, even if the family doesn't like any of what's said, the child is going to be in that school regardless, unless the parent decides to pluck them and homeschool them. So maintaining those relationships with the school and the family, between the two of them, is very important. And it's important to the child as well, because when they see that everyone's working so well together, it kind of makes them feel at ease as well. Because when Lisa talks about having that youth voice at the table, myself personally, I ask the youth too, what are your circumstances? Why do you feel like we're here? Why do you feel like there's problems at school? What would you like to see different? How can we support you with getting to where you feel like you're secure, safe, and your needs are being met? So when Lisa talks about that family voice, that's 100% correct. That's one of the people we would discuss what needs to be done to get them to that family vision. Lisa?
Yeah. So for family systems managers, it really depends on the family. At least I can't speak for all the FSMs. I know for me, it depends on the family and what they need, what their needs are, to who I'm going to work with, connect them to and work with them through for the community. It could be, there are often times that I'll do a handoff to Shannon when I'm like, okay, this is more educational. Like, you need support in the school that's more than and we can work hand in hand kind of together, but being able to connect families to the resources that they're saying they need. And it could be juvenile justice. It could be answering a question about DCF. It could a policy or a procedure, or how do we get through this system? It could be faith-based. It could be a youth service bureau. So I have a lot of folks that I work with in the community, but it really, not every family is going to be able to benefit from some of those connections and those relationships. And for family systems managers, there's a lot of helping families navigate those systems, but also helping them to be able to advise. So if there's a provider, I'll use a youth service bureau for an example. If they are working with youth service advisory and they need family voice, the provider says to me, hey, we need family voice for this. Do you have anybody that would be, able to do this? That's when I can reach back out to the families to empower them to go and make their voices heard and their ideas heard as an advisory to whatever agency or whatever provider that has come to me and said, hey, we need some family, voice. That being said, I feel like it's just really relational and not transactional. So it really just depends upon what the family needs and then what the youth needs are too. Because sometimes the youth, what their needs are different than what mom and dad say they are, and trying to connect them to the whole family considering that and connecting them to whomever they say that they feel like they need or what their struggles are. And then again, working with the provider side, it's sometimes they're coming to me. Sometimes I'm going to them saying, hey, we have this. So for family systems managers, it really is, for me, per family.
Thank you so much. And that kind of made another question pop into my head, if that's okay. I know, and I completely understand and get that every single family and every single family dynamic is different. Every single family has different needs, and I'm sure that there's different needs based off specific region. But is there one thing that you find families tend to need the most that they have trouble with, and what is that one thing?
I have been finding in my area, it's the wait lists for behavioral health support. The lists have gotten extremely long, and the pandemic caused some agencies to lose some staff for varied reasons, but I'm finding that their wait lists are getting rather long at this time, and the kiddos need that support now, and later just isn't enough. Like telling a child you can't have that support until you come up on a list, or having to tell the family that, it hurts my heart because I know how much it's needed. So that's the one service in my area that I feel like we could really use some support from other agencies to kind of do some hiring, pull some newbies in, and get these kiddos the behavioral support that they need. Because without that support, it becomes an issue with getting them to school, getting them to maintain at school, getting them to maintain at home. And it's not anyone's fault, particularly, it's just the service isn't there. So that would be something I would like to see come up in the future, is that there's more agencies putting more professionals in place to help families and kiddos work through these huge issues.
Thank you, Shannon. And I just want to say that, unfortunately, my family has fallen victim to the same struggle of the behavioral support and those long waiting lists and the lack of services and the time between counselings. And, you know, that's something, and I know I'm not the only family, and I was at my son's school today talking to the school psychiatrist, and she was explaining, she had the green shirt on supporting Killingly School-Based Behavioral Health Center, because I see, for those, everyone's just listening, but you can't see this, but Lisa is cheering in the background. Because I know we've touched on this topic a little bit on Caregiver Chronicles, but Lisa has been next to me in meetings, and has been at meetings, and has kept me updated on what's going on. And just, you know, I thank her for that support, because she doesn't, you know, she's just another person who's just advocating and supporting the town and the kids in the school. So I appreciate that. And thank you so much, Shannon, for pointing that out, because I couldn't agree more. I know for my family and for families that I see. Lisa, is there anything you want to add?
I would add, I wouldn't agree with Shannon on that, but I also add, I think some of it is that for our part of Connecticut, where I cover, is more rural. So access to services and providers, it's often a drive. And that because of socioeconomic status, there's not always transportation. And if they are, because this is just how it works, they don't connect to each other, which makes no sense to me, but there's that transportation. And then having, if you need a specialist, sometimes you're traveling to like Hartford or Farmington, which depending on where you are in our region can be an hour and a half to get to. And that is time out of work, so money lost. It is transportation, it is gas, it is all of those things. So along with wait lists, folks are having to go further away to get those services into more of the urban areas. And also a lot of it is basic needs that are not being met. And folks just thinking, well, this child's acting this way because they plan to act that way. It's purposeful, but it really is just an unmet need. And there's that disconnection between school and home, or maybe not even a disconnection, but a lack of communication and understanding of that from everybody. And I think if there was more communication kind of around that, of like, are there any connecting them, schools being able to connect back to folks like me or Shannon or somebody else in the community that knew the resources, because that's something that Shannon and I can do. Is if it's like, I've gotten calls from, as an example, from a provider, like, hey, I have this family, but I don't know, like, who, like, this is, you know, what we think is going on, and being able to either talk to the family or kind of have the school be that liaison has been helpful for families to get what they need, because they can get connected to somebody else in their community who will have better resources than maybe myself, or better fit what their needs are.
Awesome. Thank you. Thank you so much for that, Lisa. I think that those kind of touch on some of the main issues that my family is experiencing. So I hate saying this because it sounds rotten, but it's good to know I'm not the only one. And I wish I was the only one all at the same time, because I would rather not have to have families have to experience some of these same issues, the long wait lists, the having to travel over an hour for an appointment. We prefer actually to go to Providence with our kiddos, and we're fortunate we're a 2-vehicle household. We prefer to go to Providence with our kiddos because my husband works in that city, and it's closer and it's just easier. Sometimes getting a doctor approved in Providence through Connecticut Medicaid can be a hurdle. Again, communication with the schools for me is pretty good because I have advocated so much for call me and give me it in writing, and sit down and meet, and what can I do? And I ask the school, how can I support my child both at home and at school? That, I am grateful for that. But, a lot of parents don't know to do that. They don't have the coaching. I'm lucky I had a great coach, someone who told me to say, hey, get it in writing and go, talk to them. And it's okay to be a little bit of a pain in the butt. So I'm just, it's validating to hear that I'm not the only one, unfortunately, who's experiencing some of these things, but it's frustrating and sad, and it hurts my heart to know that there are other families that have to endure these same struggles. So hopefully you guys can get word out, and hopefully Caregiver Chronicles, hopefully someone who's facing these issues in this part of the state hears this episode and it is helpful. So is there anything else you guys would like to add?
I just want to add, Sarah, that there are family systems managers and family peer support specialists across the state of Connecticut. So if you're not in the Eastern region, we can get you the information. It's also, again, on the website. You can pick kind of where you are, and it'll give you the information for those people. But also, just to you saying, you're not it's hard to say, like, I'm glad that I'm not alone, but I wish I was. There's something unique about Favor as a whole, is that 98% of us have some form of lived experience. So when we're coming to you and working with you, we've lived it, we've breathed it. And I think that makes Favor unique in how we work with families and how we connect families and youth to what they need.
Thank you. Thank you for that. I really appreciate that. And one more question I don't believe I asked. Is Favor a national program?
So we are not national. We are Connecticut's chapter of the National Federation for Families, but we are not a national agency. Through the beauty of Zoom and online platforms, we are able to engage folks kind of across the Connecticut lines in different states through trainings and through some of that technical support for other agencies. And I've had the pleasure of working with folks from Ohio to help kind of build a family advisory board that I spoke a little bit about earlier, really providing that technical assistance of how to build the advisory, and kind of how to build it, how to engage families, how to keep them engaged, and get everybody involved. So though we are not national, we are the Connecticut chapter for the National Federation of Families. And we now, again, because we have Zoom and Teams and all of those Google Meets, all of those wonderful things, we're able to kind of help provide some of that assistance across state lines as needed or as requested.
Awesome. Thank you guys so much. And just really quick, I know that your website does take donations. And so if you could just share the website and where to donate, that would be great.
It is favor-ct.org. And if you scroll to the bottom of the page, there's a section that will say donations, and you can donate through that. Lisa, do you know of another way?
Just the website, I believe, at this time. We also have a Facebook and an Instagram, Favor CT. If you Google it, it will pop up. You can follow us there and kind of see what we're up to, and training opportunities and all of those good things.
Awesome. Thank you guys so much. And I will have all of this information in our show notes. So if you're listening to this episode, you can just click the notes, the information, especially through Spotify. You should be able to just click the links if you're interested in learning more about Favor or reaching out to anybody from the organization. that will wrap up this week's episode of Caregiver Chronicles. Lisa and Shannon, thank you guys so much for coming on. It was just really nice to have the chance to interview you guys, and informative, and again, validating. So thank you guys again. And to our audience, you can reach us if you have any questions, comments, or concerns about this episode, you can reach out to us at caregiverchroniclespod@gmail.com. You can find us at Facebook, Caregiver Chronicles, Twitter, CaregiverChron1, Instagram, Caregiver Chronicles 2. We are now part of the Whole Care Network, as you have heard the intro. And just reach out to us if you like what we're saying, or if you know somebody who needs to hear anything that was said in this episode. Please share it with a friend. Leave us a review. Reviews help us out tremendously. So thank you all, and we'll see you next week.